Hi, we're going to do a filler injection for our volunteer patient here. We're going to inject her laugh lines, which are referred to as the nasolabial folds and the marionette areas. If you look at most patients, and starting in about the 20s and definitely getting worse with age, the line starts from the junction of the nose and it goes out laterally towards the outer portion of the lips. These are referred to as laugh lines, and if she smiles for us, or smile lines, you can see that they get deeper. Now if you relax, you can see that this line is created by the descent of the cheek pad. This little bit of soft tissue here, a few years ago, was up higher. And what happens is it starts carrying on downward, and with age it gets worse and worse and worse. There are lots of different options for treating this area. A mid-facelift takes this tissue pad and resuspends it up in a surgical fashion. Other options are filler injections, fat injection. If it's worse enough, subcision, which actually releases the scar tissue that's created between the skin and the deeper structures. But 9 out of 10 times, most patients these days are getting filler injections. They're outpatient procedures. It takes just a few minutes to do, very low risk, and they get back to their regular activities, and it looks very natural. There's lots of options. Juvéderm, Perlane, Restylane, Radius, Artifel, they're all choices that are safe options in the United States, all FDA approved. What we're going to do is Juvéderm, which is one of my favorite substances because of its texture and its longevity. We're going to prepare her. What I first do is I go ahead and take an alcohol wipe and I prep the area that I'm going to inject. Then we take the substance. It comes pre-packaged with its own very small 30-gauge needle. The needle has to be placed on very tightly with Juvéderm. With Restylane, you don't want to tighten it too much. With Juvéderm, you have to tighten it. Those of you who've seen the needle pop out during the injection know why that is. We're going to start with two different techniques. The first technique that I like to use when I inject Juvéderm, or any filler really, is to fill the area in a longitudinal fashion. I go right under the skin. With Juvéderm, you can be very close up to the epidermis itself. After I do a longitudinal filling, I like to do perpendicular, especially up high, close to the junction of the nose. It allows the tissue to be pushed away in a very natural fashion. As in any filler, when I inject it, I massage it. And after I massage it, I don't feel any lumps or bumps. It's gone. A lot of times with age, patients start developing a little bit of a shadowing right here at the corner of the lip. That's called the marionette area. The best way to remove that is to fill it, which pushes the corner of the lip upwards. There's a little triangular zone, depending on the age of the patient. Our volunteer patient is very young, so we don't need too much. But in older patients, you want to actually inject the entire triangular space in this area to fill it and push it up. But in a younger patient, such as this, just a few little blebs do the trick and push the lip up nicely. And I have them hold a little bit of pressure, and I go to the other side. Start the same way. Start with the longitudinal serial injection. The depth with Juvéderm is going to be different than the depth with, for example, Radius or Artifel. You can be closer to the epidermis, and you can actually see the location of your needle and the filler as you're injecting. With Artifel and Radius, you definitely are going to be deeper. If you see your needle, you're up too close to the skin, and you're going to have a bad outcome. So choosing the proper filler isn't all about longevity of the substance, how long it lasts, and the cost of the substance. The nature of the line in the fold is also very important. We're going back down here to the marionette area. Pushes the lip up really nicely. What I do now is, I always save a little bit after injecting a symmetric amount. I save a little bit. You can go and hold this. And I compare the sides. And I do my fine contouring after I've compared the sides. Often you need a little bit more on one side than the other. Our patient's right side is deeper, and I knew this beforehand, so I've already put in a little bit more on the other side. But most of the time, you do a symmetric amount and then you judge. So what I do is, I take a look, I step back, lift your head for me. Don't smile, just relax. Good. Put your head back. I'll take those from you. We'll just do a little bit of contouring here. Gently hold this here for me. Come back to the other side. And if you hold pressure for about a minute or two, that reduces chances of bruising. Bruising in this area is really rare, even though with every needle stick you do see some oozing of blood. It's rare for patients to get a bruise. Unlike the lips, where bruising can happen, but again they can be covered with lipstick or makeup immediately afterwards. So after she holds it for about a minute, we're going to finish the injection. She's held on to a little bit of pressure there for about a minute and a half. She's taking it off. I don't see any significant bruising. A couple of very small little purple spots, which are really easy to cover with makeup. And that's the final result. It's very natural. Don't smile. Okay, pull back. Okay. And you can see the final outcome. Now what happens over the next several days, the substance is hydrophilic, so it actually attracts more water and more fluid, so it will even fill in more over the next several days. Thank you.